how do you differentiate the three common disorders which we see is Alzheimer's, Parkinson, and dementia? I just want to understand the difference from an audience perspective, right? How do you see this?
All the three are neurodegenerative diseases. When I say neurodegenerative diseases, what does it mean? Does this happen only in old people? Not necessarily. When I'm saying neurodegenerative, we know that there are some changes or degeneration that is happening within the brain, which leads to these conditions. That's why we call them neurodegenerative conditions. The first thing is Parkinson's. In Parkinson's, we know that there is a deficiency of production of a very important chemical in the brain. That's called the dopamine. So that is the degeneration that is happening in Parkinson's. So we all know that the brain works through electrical circuits. So they're very, very important different circuits in multiple areas of the brain. And this dopamine is a very essential component in what is called as the movement circuit. That means how you move, how you act, how you walk, how you speak. That important circuit, this dopamine is an important chemical which is required. So what happens in patients with Parkinson's is when this thing becomes deficient, they become very slow. They start having tremors or their hands keep shaking, which is because of, again, this dopamine deficiency leading to an abnormal firing of different neurons. The second thing is dementia. What is dementia? Dementia is, again, as you age, there are some atrophy or the brain starts to shrink. And if it affects the memory circuit, then you start developing memory disturbance. That is dementia. One of the differentiating or one of the most severe forms of dementia is Alzheimer's dementia. So Alzheimer's can also happen sometimes in your late 55s or 60. Usually it sets in much later. But again, in Alzheimer's, we see definitive degenerative change within the brain where there are abnormal deposits within the brain. So that's how we know that Alzheimer's is also a progressive dementia disease.
If this sparked a thought, imagine the full conversation. Tap to subscribe and explore with us.